is one of the countries working towards achieving universal health coverage for citizens. So is UHC a distant dream for many Namibians? And how far is the country from implementing UHC? To answer these questions and many more, our reporter Renate Rengura and camera operator Matnamadi Haidullah are on standby at Swakopmund with the details. Renate, it's over to you.
Well, thank you so much for linking up with us again. We are coming to you live from the MTC Dome, where the consultation between the Ministry of Health and the Parliamentary Standing Committee on Health Matters is taking place. The meeting is discussing matters of universal health coverage. Now, to talk to me about UHC, I am joined by the Executive Director in the Ministry, Mr. Ben Nangombe. Good afternoon, sir. Thank you so much.
Good afternoon, Renate. How are you?
I'm very well, thank you.
Very good.
So you are discussing UHC in the building behind us. Can you just maybe break it down to our viewers? What does UHC actually mean for that mother who sells kapana, or for the father who is busy standing on the sides of the road just looking for a random job? What does UHC mean for them?
No, thank you very much. UHC stands for Universal Health Coverage. It's an initiative adopted by the international community to bring up a situation where healthcare services are available, they are of good quality, they are affordable, and in accessing healthcare services, people should not experience what is known as financial hardship or financial catastrophe. Because we know that in many instances, you may find a situation where as much as the provision of public healthcare services in our country, for example, are largely free, maybe somebody would have to sell their chicken or sell their ox in order to access healthcare services. For example, a person may be going to a hospital, yes, getting there and receiving healthcare services is free, but in order to get transport money, for example, you may have to sell your chicken. So we want to have a situation where public healthcare services are available, they are accessible, and those that are seeking these services do not have to experience financial hardship. That is at the center and the core of the UHC approach. Now, why are we engaging with the members of Parliament, Standing Committee on Health Matters? When we started as a Ministry of Health Social Services to spearhead the development of the Universal Health Coverage policy framework, we felt it appropriate that we must get the buy-in, we must get the inputs, we must get the ownership of the various stakeholders. So what has been happening since 2018, we have engaged with the private sector, we have engaged with community-based organizations, we have engaged with other offices, ministries, and agencies so that we can have a common understanding of what universal health coverage must mean for our country. So for a woman who is selling kapana on the roadside, or for a man who's standing at the roadside looking for a job, what the aim of universal health coverage is to enable them to access quality healthcare services without suffering financial hardship. That is what we aim to do. So the consultations with the private sector, for example, whether it is with insurance companies, whether it is with medical aid funds, whether it is the private health industry, is to see how do we make it possible for these stakeholders to contribute to the vision and to the financing of universal health coverage. We have, for example, the medical aid fund for public servants, for civil servants in this country. It caters for about 200,000 people. but it gets a budget of about $3 billion. The budget for the Ministry of Health for the rest of the country is about $9 billion, meaning that we need to find a solution to funding universal health coverage. We need to unbundle the way in which we are funding healthcare delivery in this country. So we now want to have the buy-in for members of parliament, for the members of the standing committee, so that when this matter eventually goes to parliament, they have a common understanding. So we have an extensive program, a comprehensive program, where we are sharing with members of parliament, starting with understanding what is universal health coverage, understanding the costing and the financing of the public health sector in Namibia, understanding the policy environment in Namibia in terms of what, from where do we draw our mandate to implement universal health coverage. So to that's to the extent to which we have gone to engage. And also perhaps for me to inform members of the public is that we have developed as a ministry the policy framework for universal health coverage in Namibia. It has been submitted to Cabinet. Cabinet approved it in 2022, and it's on that basis that we are now talking to the various stakeholders so that they can tell us how can we improve the implementation mechanisms for universal health coverage in Namibia, and it's exactly why we are engaging members of parliament so that when this policy framework is eventually submitted to parliament, they have a full understanding of where we are coming from. That is the importance of universal health coverage for all Namibians. Not only that lady who's selling a kapana or the man who's standing by the road, but all other Namibians across the length and breadth of the country.
So at the rate that we are going, when do you think the implementation will actually happen?
Well, this is a very ambitious initiative for the country. We are talking about literally transforming the delivery of public health care services in the country. It's not something that can be done in a year or 2 years. We are in it for the long haul. It's going to require systemic and systematic change in the way we deliver public health care services. It's going to change the way in which the private sector is involved in the provision of healthcare services in the country. So it is not something that we can say is going to be done in 2 years or in 3 years. We are in it for the long haul, but at the end of the day, what we want to achieve is ensure that all our people are able to access public health care services without suffering financial catastrophe. And this is something that we have actually already started doing, because we have learned very good lessons, for example, from the COVID-19 pandemic. When COVID hit Namibia, we had about maybe 16 to 19 ICU beds in the country. A few at Nangombe Hospital, a few at Oshakati Hospital, a few at Katutura Hospital, and a few at Central Hospital. Having learned lessons from the COVID-19 pandemic, very soon we are going to have more than 200 ICU beds in the country. We are rolling out what is known as the National Surgical Obstetric and Anesthetic Plan, so that we are able to, for example, conduct the basic surgical procedures where women who are giving birth don't have to travel long distances, where people who have minor injuries don't have to travel long distances, so that we are able also to decongest the referral hospitals at the center. That is part and parcel of universal health coverage. We are moving towards the installation of dialysis equipment, for example, in our health facilities. In all district hospitals, we are going to put dialysis units so that a person who needs dialysis does not have to travel to Vendu from Katima Mulilo or from Kiet Mansuop or from Mashakati to receive dialysis services. We want these services available in the district hospitals so that we literally bring services closer to the people. And this is part and parcel of universal health coverage. We are engaged in the training of healthcare workers, specialist doctors, so that, again, they can provide services in the communities where the people are. We are in the process of finalizing the Health Professions Council's bill that is going to allow us again to be able to deploy the doctors, to deploy other healthcare professionals in areas in the country where they are needed most. So this is all part and parcel of implementing the universal health coverage principles, and the progress that we are making is encouraging, and we believe that it's something that is doable and it's going to be so beneficial to the people of this country.
Last question, Mr. Nangombe. How do we fare as a country compared to other African countries or the SADC region? I
think different countries are at different stages of implementing universal health coverage. There's not a specific matrix. I think the Health Organization does conduct some measurement in terms of where each country is. But what I know, for example, is that countries like Ghana have done very well in terms of moving forward in the implementation of universal health coverage in that country. But again, this depends on the vision of each country. One country may say, if we have, for example, rolled out childhood vaccination, if we have rolled out the ability to conduct surgical procedures in district hospitals, then we have achieved universal health coverage. So our vision in Namibia is what we are busy articulating. That's why we are consulting with our stakeholders to tell us what is it that will be the ultimate goal and how should universal health coverage look like in Namibia. That's what we want, and we don't want it to be a one-man show, a Ministry of Health and Social Services show. We want each Namibian to participate and say, when you talk about universal health coverage, we mean that the vaccinations are rolled out, we are able to conduct surgeries at district hospitals, we are able to have this service and that service and that service in our hospitals. So that is why we are consulting, so that we have a vision to which all Namibians have contributed. So each country is approaching this at their own pace, and I think when we have measurements conducted by an independent entity, such as the World Health Organization, that's when we will know, then we can say, okay, we can compare Namibia to other countries based on these variables.
Well, we have run out of time. Mr. Nangombe, the Executive Director in the Ministry of Health and Social Services, thank you so much for talking to us.
Thank you very much, Nana. I highly appreciate it.
Well, this is not the end of the story. The consultation will continue to tomorrow. But that's it from me, Renate Rengura, and my colleague, Ms. Martha Namadi.